All True Hospital in Grand Forks recently added a cardiac surgery team to its neonatal intensive care unit. The team has already had 3 successful surgeries, and neonatologist Durga Panda is a part of that team. Thanks for coming on the show.
It's my pleasure.
Well, I want to talk about you first. When did you, I guess, know that you wanted to get into the medical field?
I guess that is something that I didn't have a choice. I come from a family of doctors. My grandfather, my father, both of them are doctors, and so are my siblings. So to get into medicine was more like a natural process, but I did choose which field I wanted to go, and that was pediatrics before coming in, and no points for guessing it's from India.
Why infants?
I was in love with kids. It was more of like interest in them, and also that I thought maybe they were a lot less complicated than the adults, and that's why I got into it. But I fell in love with this, and I never regret for a day what I chose.
Sure. Well, speaking more about where you work, the neonatal intensive care unit, the team that you're part of, has started doing cardiac surgeries now. Right. And why did All True go down this path to do this?
Oh, it's coming from the same point or same question that you asked me before, is that although it was a love for pediatrics, but neonatology was more of a passion. I wanted to go into that because I loved the whole thing so much. And I was trained at Children's Hospital of Los Angeles, and from there I was recruited here at All True about 4 or 5 years ago to set up and develop the unit, for which we are very fortunate to have a very supportive staff and a very supportive administration. We developed slow, step by step, and we are very proud and very happy to announce that we have pretty much the cutting edge technology that is available anywhere in the world, including big centers like Mayo and Minneapolis. And what we did was go up step by step, and now very proud to announce that we can take care of any kid of any severity as good as anywhere in the world.
Wow. Well, that's a huge claim. Mm-hmm. When you have to make that call to perform a cardiac surgery, what usually leads up to that? That's obviously not the first thing, the first solution.
Good question. In fact, actually, I just wanted to take a step back and explain it to you that in NICU, the majority of the patient load is what we call as a premature babies. And premature babies, just for the fact that how God intended it to be, have a small little hole in their heart, which is natural for everyone, including you and me had it when we were small. And it's supposed to naturally go to a closure before they're born or right after they're born. So what happens is when they're born this early, the hole in the heart remains open. We have a lot of other methods, including medicine and non-invasive methods, where we can try to close it, and thankfully and luckily 8 or 9 out of those 10 kids that we treat closes on its own. It's that occasional 1 or 2 for multiple different factors stay open, and we don't have any other choice but to open it and close it surgically. Otherwise, we'll get into more trouble.
So you're not the surgeon, but you're part of this team. Are you in there during the surgeries?
Yes. In fact, this whole cardiac surgery in neonates, I mean, imagine just the fact that cardiac surgery is complicated enough, but it makes it like 10 times more difficult based on the fact that size and the tolerance power of a little neonate who's like barely 500 grams or 700 grams to tolerate this kind of a surgery. So it's not a one-man thing or one-woman effort. It's a whole team where we have to sedate the kid, make sure that he or she is in good shape or situation to get the surgery done successfully.
Well, and as a layperson and a father, thinking of working on a little baby, to me, would be one of the most nerve-wracking situations to be in. How do you deal with that?
It's not easy for us as well. It's part of it is the training in which we basically prepare ourselves. And to go back to the same thing at All True is that not yesterday did we decide to go for it. It needed a lot of training, a lot of preparation, and a lot of other getting ready to the big event of doing this kind of a surgery. It took almost 1.5 years to 2 before we actually did the first one, and that is how much preparation it takes before we venture into something that's complicated.
And so how much of a celebration happened after the first successful surgery?
The celebration is in the success itself.
Yeah.
I think there is no bigger satisfaction or celebration in compared to looking into the parents' eyes and announcing to them that this has been a successful thing and your baby will live and function normally as any other kid. So that is, from my side and my team side, the biggest celebration we've had.
You talked about these small people that you're working on. What is the biggest challenge with working with such a small person?
The size, of course, brings in a lot of challenges, and I say challenges because every one of them we have overcome just by the sheer determination and of course the technology, which has gotten so much better over the last few years and the last decade more so. I have to mention this, that because of we dealing with very small kids, we do not have what we call as a second chance, or we mess up and things get better later. No, what we have to do is to make sure that we do try all the proven technology, all the proven methods, and doubly sure before we venture into taking care of neonates, because they never give you a second chance, and we don't plan to use it anyways.
Well, congratulations on the expansion and continued success in the program. Thanks for coming on the show today.
Thank you very much. It's a
All right.
pleasure.